Today, I would like to give a brief overview of what, in my view, we must do to respond to this crisis. First and foremost, we are dealing with a national emergency, and the President of the United States must understand that and declare that emergency. Next, because President Trump is unwilling and unable to lead selflessly, we must immediately convene an emergency bipartisan authority of experts to support and direct a response that is comprehensive, compassionate, and based first and foremost on science and fact. In other words, Congress, in a bipartisan manner, must take responsibility for addressing this unparalleled crisis. Further, we must aggressively make certain that the public sector and the private sector are strongly cooperating with each other, and we need national and state hotlines staffed with well-trained people who have the best information available. One of the aspects of the current crisis is there are people who are asking themselves, what are the symptoms of coronavirus? Do I have a cold? Do I have the flu? Do I have the coronavirus? Who's going to help me? Where do I go to seek medical treatment? How do I get a test? When is that test going to be processed? People have a lot of questions. And at the statewide and federal level, we need experts to provide the necessary information to our people. The American people deserve transparency, something that the current administration has fought day after day to stifle. In other words, we need to know what is happening right now in our country, in our states, and in fact, all over the world. If there was ever a time for transparency and honesty and being straightforward, this is that moment. And we need that information coming from credible, respected, scientific voices, of which we have many in our own country and all over this world, not from politicians. And during a crisis, we must make sure that we care for the communities most vulnerable to the health and economic pain that is coming. Those in nursing homes and rehabilitation facilities, those confined in immigration detention centers, those who are currently incarcerated and in jails, and all people regardless of their immigration status. Unfortunately, as I think the American people increasingly understand, our country is at a severe disadvantage compared to every other major country on earth because we do not guarantee health care to all people as a right. And as we speak, some 87 million Americans are either uninsured or underinsured. And when you are uninsured or underinsured, you hesitate about getting the medical care you need because you cannot afford to get that medical care. The result is that millions of our people cannot afford to go to a doctor, let alone pay for a coronavirus test. So, while we work to pass a Medicare for all single-payer system, the United States government today must make it clear that in the midst of this emergency, everyone in our country, regardless of income or where they live, must be able to get all of the health care they need without cost. Obviously, when a vaccine or other effective treatment is developed, it must be free of charge. We cannot live in a nation where if you have the money, you get the treatment you need to survive, but if you're working class or poor, you get to the end of the line. That would be morally unacceptable. Further, we need emergency funding right now for paid family and medical leave. Anyone who is sick should be able to stay home during this emergency and receive their paycheck. What we do not want to see is at a time when half of our people are living paycheck to paycheck, when they need to go to work in order to take care of their family, we do not want to see people going to work who are sick and who can spread the coronavirus. We also need an immediate expansion of community health centers in this country so that every American will have access to a nearby healthcare facility. Where do I go? How do I get a test? How do I get the results of that test? Need greatly to expand our primary healthcare capabilities in this country, and that includes expanding community health centers. We need to determine the status of our testing and processing for the coronavirus. The government must respond aggressively to make certain that we, in fact, have the latest and most effective tests available and the quickest means of processing those tests.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.